First thing we're going to do is remove our soda sorb canister. Looks like this. You're going to go ahead and dump this down into the trash. Just make sure you don't lose this center part here. Go ahead and take that out. Okay, so this is a new pack of soda sorb. You'll either see it in a package like this, which they usually keep above the countertop in one of the shelves, or if they don't have these, they'll have a 5-gallon bucket full of the same stuff. Just ask the staff where their soda sorb is, that way you can replace it. Okay, so off video, I went ahead and taped this hole right here. You don't want to get soda sorb down in here, otherwise it'll get all throughout your rebreather circuit. And then you go ahead and fill this up. And if you're using one of these bags, just fill up with the whole bag. If you're using the bucket, you want to go just to the shoulder of this container here. You may need to shake it just to make sure it's all level in there. Okay. Throw that bag away. And then shake it till it's level. And then do not forget to remove your tape. Okay, so next, before we put our soda sorb canister back on, we're going to want to get Oxyver. It's this product right here. It should be in all the Petcos. Go ahead and spray on the paper towel, and you're just going to wipe this gasket here. There may be some kind of powdery debris from the old soda sorb. We just want to remove that and make sure that this gasket is clean. Just like that. Okay, so while we let this dry over here from cleaning it, we're going to go ahead and take the opportunity to change out the date on our soda sorb canister right here. Go ahead and put the new one on, take our old sticker off, and you're going to line this up with this right here, make sure it's centered, and then just hand tight. Next, we're going to go ahead and change out our scavenger filter. The scavenger filter filters out any exhaled anesthesia gas from the patient. So as this gets used, it increases in mass. So we're going to look at the weight received. This one was received at 245 grams, and we're going to replace it if it's over 50 grams from the received weight. So let's go ahead and power on our gram scale.
They have these here at Petco?
Yes.
Okay.
Yeah, just ask the staff for their gram scale, they'll give you one. Let's go ahead and switch the units to grams. Press tare to zero out. And we're going to go ahead and weigh it. This one's at 283. So we're roughly about 40 grams of increase, so this is still good to use. We'll go ahead and reinstall it back here. Okay, let's say that our old scavenger filter had increased over 50 grams from the received weight. What we'd do is we'd grab a new scavenger filter and we would weigh it. This one's at 238. So we'd take this, and right here we would write 238, and then we would go ahead and install it right here. Okay, so on your anesthesia machine, you have two different circuits. You have your rebreather circuit, and you have your non-rebreather circuit. Your rebreather circuit is used on primarily dogs and larger animals. The benefit of the rebreather circuit is it filters out the exhaled CO2 from the animal and recycles the anesthesia gas. into the circuit. So this will allow the hospital to go through less anesthesia agent.
Okay.
Over here we have your non-rebreather circuit. This is used for cats and smaller animals. This one bypasses your soda sorb, so it's not recycling the exhaled anesthesia gas. The downside of this is it's going to use more anesthesia agent. However, the patient's not going to have to breathe through all of the soda sorb, which kind of requires a bit of force. So a smaller animal is going to have a more difficult time doing that, so we put them on the non-rebreather circuit. This is where you would connect your non-rebreather circuit to. Here are some examples of your rebreather circuits right here. You can tell the difference between a non-rebreather because it has this tube right here. It looks just like this. Okay, your non-rebreather is only going to have one connection here and a small skinny tube that goes down here. So you're going to want to go ahead and inspect all of your reservoir bags for any tears. They like to tear especially along here on the edge and then towards the bottom. But you're just going to give it an overall look, kind of pull and stretch a little bit to look for any holes in the reservoir bags. We'll go ahead and inspect all of the bags before we do our leak tests on them, just to, go ahead and put ones to the side that we see any obvious holes in. So in order to hook up a rebreather circuit, you're going to look first for the inspiratory side and match that up with your inhalation side on your machine here. Go ahead and put that on. Oh. See here, we found a little bit of a problem. This is turning here, so we want to go ahead and make sure it's nice and tight. Alrighty, go ahead with a clockwise motion. Put that there, and then we're also going to hook this piece up right there. Okay, now that we have our circuit set up, we're going to go ahead and turn on our O2 tank back here. You'll see the gauge come up right here. Make sure it's not empty or needing to be refilled. If it is, go ahead and replace it. Should be full. Next over here, we're going to switch from main to auxiliary. If it's on main, it's going to be drawing its O2 source from the concentrator. We want to draw from the tank. So we'll flip it to auxiliary. Next, we're going to close off our safety valve. We're going to cover the end of our breathing circuit with our thumb. Make sure you put a good amount of pressure on there so we don't get any leaks. And I like to take that same hand and rest it right here on this plunger. If this is not depressed on your safety valve, you won't be able to do your leak test. So we're going to set our hand right there. You're going to take your reservoir bag and connect it down here. And then we're going to press our O2 flush while we look at our manometer. We want to get this up to about 30 centimeters of water. It's going to take a minute because your reservoir bag is going to need to fill first. Once it fills, it should start building pressure. And we found a problem. You see here how the needle's falling down as we press our O2 flush? We get to 30, and as soon as we let go, it leaks down. You can put your hand down here, and I can actually feel a hole.
Oh,
You
yeah.
see that hole there?
Oh, yeah, it's a giant hole.
So this is exactly why we do a leak test on our anesthesia machine, is to check for things like that. So this one we're going to set to the side and let the staff know that this is no good, needs to be thrown away. Let's grab another 3-liter bag. We're going to hook this up. If you ever have a leak, it's usually because of the reservoir bag. It can also be because you have cracks on your breathing circuit as well. Less common problems, or you have bad O-rings here on your flutter valves. Maybe you didn't seat your soda sorb correctly and you're getting a leak through here. That's why we clean that O-ring when we change out the soda sorb. 9 times out of 10 is going to be your reservoir bag or your breathing circuit. So let's go ahead and try that again. We're going to cover the end, make sure our safety valve's closed. With that same hand, push down on the plunger, and we're going to push our O2 flush. I'm going to let that reservoir bag fill up. Once it gets to 30, I'm going to let go. And we're going to hold it there for about 10 seconds. It may go down just a tad in the beginning, but it should kind of settle out and stop moving. So as you can see here, this one does not have any leaks. So we know that this circuit with this reservoir bag is good to go. If you do have a little bit of a leak, your needle will slowly fall down. If that's the case, we're going to want to just go over here and turn our flow on. And you're just going to do that until your needle stabilizes. Once your needle stabilizes, you'll look over here and see what your flow is at. If it's at 0.2 liters per minute or less, you're good to go, no worries. If it's above 0.2 liters per minute, that means that we have a significant leak that we need to troubleshoot. So you have all this pressure in here. What you don't want to do is release your thumb and just let all this pressure go through the circuit. What that'll do is cause dust particles from your soda sorb to get up into your flutter valves and can cause some damage. So what we want to do is release from here, from our safety valve, just lift up, let that pressure come out, and then release our thumb. Okay, as you can see, off camera I swapped out our hose. This one's red, the other one was blue. They're just different sizes. We want to check all of their breathing circuits that they're using. So we're going to repeat the same process. I left the same 3 liter reservoir bag installed. That way, if I do get a leak, I know it's because of my breathing circuit, not because of my reservoir bag. So I'll go ahead and repeat the same test. As you can see, this one is actually falling a little bit here. So let's go ahead and bump this up to 0.2. Let's see if that stabilized it. So we still are leaking there. Let's go up to 0.3. Go back up to 30. Okay, so we have about 0.3, 0.4 liter per minute leak here. That is not acceptable. So because we've already done our previous test with our other breathing circuit, we can pretty much know for certain that this is not good. But before we just go ahead and throw this away, I want to double check because, well, we don't need a double check. So sometimes it could just be that you didn't set it up properly and fully insert one of these 2 hoses, or maybe you didn't have a really good seal here. We'll go ahead and take it off, and if you check here, you see that crack? So that crack is actually what's causing that leak there. So this would be, this would fail. They would need to order a new circuit. I don't want to just throw this away, because if this is their only one that they have, they may not have a choice but to use this for the week or so until they get the new one in. But we definitely want to note it down and let the staff know, that way they can get the correct breathing circuit to replace this part, okay? So I went ahead and put this circuit back on. I'm not going to demonstrate this part just because you've already seen how to do it, but you're going to want to make sure that you switch out your reservoir bags, and you're going to check every reservoir bag that they have on their wall or in their drawer. Wherever they store the reservoir bags, we'll want to check all of those with a known working rebreather circuit. Okay, so next we're going to set up our non-rebreather circuit. We're going to connect here. This tube here is going to go to the outlet on our vaporizer. So we're going to disconnect from our rebreather circuit and connect our non-rebreather circuit to the outlet. We're going to take one of our reservoir bags that we know does not have any leaks. We've already checked all of them on our rebreather circuit, so we only need to check one on our non-rebreathing circuit. Take this flexible tubing from the back of our safety valve on our rebreather circuit and put it on the back of our safety valve on our non-rebreathing circuit. We're going to go ahead and close our safety valve. If you didn't already, go ahead and loosen your safety valve on your non-rebreather circuit, or I'm sorry, on your rebreather circuit safety valve. Just like before, we're going to go ahead and cover the end of our tube and depress our plunger. Depending on what size reservoir bag, if you have a really small one, you're going to want to use this to inflate. If you have a larger one, you can use the O2 flush. But if you're using your O2 flush and it's just going way past 30 really quick, just know that's because you have a really small reservoir bag and it's going to be really touchy. So keep that in mind. Okay. Once we get up to 30 centimeters of water, we're just going to hold it there. As you can see, this one does not have any leaks. So we're going to let go of our plunger and then our thumb. And then we're going to just put this anesthesia machine back the way we found it. So I'm going to put all of our reservoir bags back. I'm going to reconnect to our rebreather circuit. That's how they had it. We're going to flip this back to main, but first we're going to go ahead and turn off our O2 supply. We're going to press our O2 flush just to get any pressure out of the circuit. Okay, and then we're going to go down to main. One last thing, don't forget to hook up your Scavenger system back up to your rebreather circuit. All right, the last thing we need to do on our anesthesia machine is take off this filter in the back here on our O2 concentrator. There's two tabs you got to push down on. This pulls out. You just want to vacuum all this pet hair off. Take your vacuum. Okay, I don't have one on me right now, but if you did have one of these HEPA filters, you would go ahead and swap that out as well. Go ahead and take your filter and put it back the way you found it. Then we're going to go ahead and plug into our wall. We're going to turn on our O2 concentrator and make sure that we turn our flow to about 1 liter per minute. If you do not do that, you're going to get an alarm here, because if you're not above 1/4 liter per minute, it's going to start alarming because the O2 has nowhere to go. And all we're going to check is, if you can see here, there's a blinking OK light. Once this senses above, I believe it's 84% O2, that blinking OK light is going to turn to a solid green. We just want to make sure we don't have any alarms or issues with our O2 concentrator. Okay, so it does take a minute, but after just a minute or two, you should get a solid okay green LED right there. After that, we'll go ahead and we'll turn our flow back down to 0. Something you want to check for when you go down, when you go ahead and close this, your ball should drop all the way down to 0 and should have no flow seeping by. If you do have that problem, just give me a call and I can help walk you through how to troubleshoot that. But we'll go ahead and turn that off and then just shut off our O2 concentrator, and we are done with our anesthesia machine.